So today I would like to talk about the environmental risk management of water safety. So I'd like to start with our introduction of our institute. So our institute is belongs to the Ministry of Labor and Welfare, Health, Labor and Welfare, and we are doing the administrative support, like providing the evidence and advice for communication, and scientific research. It's very close to university, so that's why we are closely working with Professor FURUMAI and other colleagues in the university and also the other institutes. And also we have a capacity development course like water suppliers and the local government officers. So we have training course and providing information and online lectures sometimes and forum. And international cooperation is other our role, and WHO, we are WHO collaborating center, and we are working with IWA and other organizations in Japan. So we have six major activities of water supply and management section. So the cooperation and communication with people is also our role. So today I'd like to explain about the environmental health and the water safety, the relationship. So where we are in history of pandemic at first. So many of you are suffering from the COVID-19 issues. So some of you are in Japan and some of you are in your country, and it is a very tough time for all of us to have a university life and also the research, continuing the research and continuing communications in between your colleagues. So when we see the history of a pandemic, we are now here. The COVID-19 issues is still ongoing, and the number of the people suffered deaths is like 6 million or over, and still ongoing. But when we look back the HIV/AIDS issues, so 25 to 35 million people, mainly in Africa and some in Asia, suffered from the HIV/AIDS issues. And so it was very serious. And we still have this kind of issue, but now we have medicine and the cocktail medicine and prevention. So the number is now decreasing. And also we look back to the 100 years ago, Spanish flu. It was very prevalent at that time in 1980s, 90s. So the people suffered from the Spanish flu was 40 to 50 million people all over the world. So there was deaths died from the Spanish flu. So it was very big issue in the history, and it's changed a lot. So in many countries, and the cholera is also popular, and maybe you may know that it's a main waterborne disease, and cholera has many outbreaks. So sometimes it breaks and sometimes it's seized, and so it's a kind of routine. And still we have some in countries, but the main of the cholera outbreak was seized in that time. So when we look back more in the century ago, so we have Black Death, kokushibyou in Japanese. So the 200 million people, and the smallpox in Japanese Tennento was 56 million of people deaths, and then these are the very big issue. So we can see that this toll, like this, that the Black Death was a very big one and the most biggest pandemic, and smallpox, Spanish flu, and plague pesto in Japanese, and HIV, AIDS, and so on. So these are the issues that we have suffered from. So the global mobilization is affecting the pandemic. So the phase one is the happening 1850, 1860s and 1870s. So many of you may know that we have closed our country for 260 years and almost 300 years to the foreign countries. So the pandemic was not affected Japan, but accordingly the port of Yokohama was opened in 1860s. So accordingly, cholera pandemic occurred in the 60s and 70s. So this is a poster that shows they have a very ballooned stomach and have a very serious issue at that time. So the number of cholera patients and deaths in the Meiji period, so you can see that cholera is in 1880s and 1879 and 1897, and the Infectious Disease Prevention Act was issued. So the patient and deaths, when you see the numbers, so most of the patient, over half, was should be died in this era because of the very effective treatment was not available at that time. So the cholera was very dangerous issue in that time. So the beginning of modern water supply was very related to the cholera issues. The first epidemic study was conducted in Yokohama and showed a link among cholera wells and drainages in 1880s. So the Japanese government and the Yokohama city decided to build a modern water supply system and designed like this, and this from the Sagami River, which was a very nice water source, and the Doshi River, and it's nicer, and from the upstream, and with a pressured water supply was provided. So you can see the map of Yokohama here, 1880s. In red plots shows the contaminated well and which yield cholera patient. So you may see that Chinese town now here, and many of them are red plots were concentrated here and others. So the Yokohama city was at that time very frightened by the cholera issues. And also they found that the red lines and the drainages, the red line shows drainages supposed to be contaminated by cholera patients. So the water issue was very important to control the cholera. So this is a poster which was shown in Fukuoka City Museum, which is also open to the foreign countries, and they have a cholera patient, and this is people who are carrying over the patient. Yellow flag was shown here, and it shows the cholera patient. So the children cannot get closer to these people. So this is a situation in Europe. In 1854, outbreak of cholera in Broad Street, London is very famous, and many of you may know that it's a start of the epidemiological study. So it's in England, and many people died from the cholera outbreak. So John Snow identified the well as the source of infection and removed the well handle, and then the outbreak was ceased. So in 1883, the Koch identified the cholera bacteria in Germany, and so the cholera was agent, so they found. So the chlorination is invented, and also it was found effective to disinfect the water. So the chlorinated water was supplied in the disinfection for disinfection in Maidstone in England in 1897. So it is the first case of the disinfection was very effectively introduced in water system in the late this century. So in 93, a paper by Nesfield was described the use of liquefied chlorine gas in water. So the 5.4 ppm for 5 minutes killed the typhoid and cholera bacteria. So it was found. So from then on, that the chlorination was introduced in some of the water supply system. And this is the U.S. situation and chlorination. So in the 1907, the effect of injecting bleaching powder was presented at the American Water Works Association annual meeting. And then in 1914, more than 20 million people were using the chlorinated water, and the number was increased in the United States. So at that time, Japan is still suffering from the infectious disease like pest, plague, and Spanish flu. So this is a poster that was stored in our library that epidemic influenza was affected people, and this is to show how to prevent the Spanish flu outbreak using the mask and covering. So this is almost the same 100 years after in our life, but now we are doing almost the same thing, but it's a very basic for the prevention of the health, prevention from the disease. So they are wearing the mask like this, and still it's a kind of the same situation. So the overview of the history is shown here. That the United States and Europe and Japan has this correlation. So the cholera outbreak was introduced, and the chlorination was introduced, and the breaching technologies were introduced to Japan in 1920s. So chlorination was introduced to Tokyo, Yokohama, and Osaka, and so the water supply system is now very strongly introducing the disinfection. So the Spanish flu was at that time. So the control of waterborne disease and the decrease of infant mortality by water disinfection is also another aspect. So here you can see the annual trends in mortality rates by cause of death. So you can see in 1918, increase in pneumonia due to Spanish flu was a steep peak like this. But still, we had gastroenteritis, the stomach disease, or the were very dangerous at that time. So the number was very much, and 20 million people were suffered from decrease in the gastroenteritis. And during the World War II, the statistic is not shown here, but they were suffered from this disease. But after that, the number was very steadily decreased. And also we have tuberculosis. It was decreased at the time, and then we are almost no tuberculosis, but we still have, and we still have to pay attention to this disease, but the number was very steeply decreased. Nowadays, we are suffering from cancer and cardiovascular diseases and pneumonia and accident and so on is the health issue. So anyway, the tuberculosis and cardiovascular disease and disease of gastroenteritis was very popular at that time. So introduction of chlorination was happened this time, and chlorine disinfection was introduced in Tokyo City and Osaka and Yokohama. So it has been pointed out that the mayor of Tokyo, Shinpei Goto, a medical doctor, and he explained his studying at the Hoffman Institute may have been involved. So the chlorination was after the World War II, General Headquarters was ordered the chlorine disinfection, 2 ppm injection at each water purification plant and 0.4 ppm or more at the end of the main pipe was very strongly ordered. So the Japanese government was followed this order, and after that, the Ministry of Health and Welfare took over until now. The chlorine disinfection is very strongly protected the public health. So the number of infant deaths and water supply rate was shown here. So you can see that the number of deaths, infant deaths, it was every year we had 200,000 or 300,000 of infant was killed by the sanitary environment. So the government decided to introduce the chlorination, and intermittent chlorination started in 1920s. So the number was decreased at this time, and then still decreasing at this time. So the this kind of number of the infant deaths seems very affected by the chlorine disinfection too. So we have to pay attention that not only the gastroenteritis and but also the number of infant deaths was decreased with a very good sanitary environment. So it's an origin of our institute. In 1938, National Institute of Public Health was established with the support of Rockefeller Foundation from the United States. So that to promote the public health issues. And in front of the institute, we had an experimental pond for coagulation, sedimentation, and filtration testing. So the issues of water was very important, that's shown. And a patient of waterborne disease itself and prevalence of water supply was also found here that it has a correlation. And the correlation in Tokyo, Yokohama, Osaka is still we have a patient, but when the mandatory chlorination was introduced and the ratio of water supply was increased, the patient number was decreased after the World War II. So this is how to show that drinking water quality and access and availability issues are related. So you can see that when you think of the countries which is still promoting the water supply system, so improved water source and drinking water quality and access and availability, the whole thing, safety controlled drinking water supply service was supported. So we have to think over the quality too to promote the public health for the promotion of water issues. So this is the building still existing, and the National Institute of Public Health. The former building is still existing in the Minato ward in the center of Tokyo, and there was also room for Dr. Markoi, who ordered the ordinary chlorination and compulsory chlorination to Japan's water supply after the war. So the building is now history museum, and we can have the have a look at the museum too. And in 1945, also we have suffered from the insects and other unsanitary issues. So the chemicals was sprayed to prevent typhus rash transmitted by flares and lice. So this kind of spraying was very popular at that time. So the chemical toxicity issue is still have a problem, but anyway, at that time it was important to prevent the public health by these measures. So the remains in our training program for environmental health inspectors is now guiding the safe disinfection and safe countermeasures to prevent public health, like cleaning and ventilations and having a good building to promote public health and so on. So if you have a question, please put in the chat, and I can answer it whenever we have a question. So I'd like to go to the phase 3. So the economic growth and environmental health issues in Japan. So you may know that human health was affected by the environment. So it has many things around you, that natural disasters, drought, fire, and environmental issues like water pollution and natural sources in Legionella. And food is also a very important factor to protect your health. And air pollution is also very important. And some of the diseases are caused by the air pollutions. And industrial discharge caused the cause of the causes at that time, and deco, and also the urbanization is a factor for air pollution. And also social determinants must be considered. Social and economical and environmental determinants affect your health. So the what is directly affecting your health is a medical system and vaccination, and healthcare system is very related to your health, but also such kind of system should be provided regardless of the income or the economic status of the people. So the equity is also a very important health issue. And education and hygiene is also important, to wash hands and to protect your health and so on. So these are the environmental risks causes which will affect your health. So how is the percentage? What is the percentage of these issues? So I will talk later. And before that, I have to talk about our pollution experience. So many of you may have heard that Japan has very serious lessons on the of public nuisance that affect the health of the people. So the Japanese lessons on the economy and the environment, our pollution experience would be can be seen at this YouTube. So it is English and very well made. So please look at this YouTube if you would like to know about this pollution experience. But today I have a very limited time, so that I will just digest some of the issues. So in the Minamata Bay, you have known that methyl mercury affected the people through the water and through the fish, which was raised in the sea. So the patient was had a lot of foods made by the fish. So the disease was caused by methyl mercury at that time. And cadmium was suffered from the outbreak of Itai ouch disease in the Toyama prefecture, was suffered from cadmium, which was come from the coal mine in the upstream. So the people were suffered from this disease with the cadmium, and still we have environmental pollution of cadmium in these areas. And also, we had arsenic problem in Tohoku and in Kyushu region. So the prevalence of the disease was found in the caused by arsenic. So these are the some of the main outbreak, our pollution experience from the environment. So these are very serious, and we have to conquer that lessons from the economic growth. So this is registered and supported people affected by environmental pollution. So you can see the total registered number of people affected. So left axis. So we have hundreds of thousands of people every year that was registered and affected by the environmental pollution. So the Minamata Itai disease was like this, and even sorry, and also we have suffered from asbestos issue, which can be seen here, the right axis. The number is less than the total registered number of people affected, but the asbestos is also a serious issue, and we still have the patient because of the asbestos is used in many buildings. So the maybe we should have 2,000 people every year who have this maybe in the this 20 years or so, some people say. So the today I would like to stress on the importance of precautional approach. So if we found the patient, so it's a little bit too late. So that it is injured, and even if the patient is still, the relationship is not so clear, but if we can have an early response, the number of the fatal effect should be decreased. But the traditional countermeasures is like this, and we should have much more effective. It would be effective to decrease number of people as soon as whatever the as soon as we should have a response. So the like early detection and countermeasures. So the as soon as is better to have an early response. And these are the lessons that we had in the history. So overcoming the environmental risks to achieve sustainable development goals, lessons from the Japanese experience is just published by the from the Springer. And I wrote a chapter of the spectrum of environmental risk assessment, management, and communication. So please refer, please read this book if you have a chance. So this is the phase 4, that the environmental health risk management. So the importance of the precautionary approach is shown here. So as I have explained that the traditional countermeasure is still too late in some cases. So early response is very important, and the early detection is better. And risk assessment and the epidemiological study is more important to introduce, because we can have a less number of people who will affect from this kind of environmental issues. So the risk assessment or epidemiological study might be maybe effective to do the to introduce environmental issues. So when we see the preventing disease through healthy environment, that is published by the WHO, global assessment of the burden of disease from environmental risk is we made a translation, and you can see that this book or the file on the internet. And a fraction of deaths and disease attributable to the environment globally is shown here. So that is a disease-able adjusted life years. So severity multiplied by person multiplied by year. So you can see that the environmental issue is over 20%, like this for the death, and like this for disease. So even if they not suffered from the death, but the disease would affect your health and shorten your life and shorten, decrease your quality of life less than the normal. So that it is explained like this, it is able to adjusted life years. So you can see that it's over 20% that explained by environment. So what kind of environment will affect you? Here is a figure that the environmental fraction of global burden disease. So you can see that injuries is a very important issue, especially for the children, like 0 to 15 years. So they have injuries, so that we have to protect the children from injuries, accidents, and so on. And NCD, non-communicable disease, is also very important in the aged people. Like so the elder people over 40, 50, 60. So the which will affect your quality of life. And infections and parasitic and neonatal and nutritional diseases also included this figure. And total and injuries is a very big fraction. So the disease with the highest preventable disease burden from environmental risk in disability and disability adjusted life years this. So we are going to explain about lower respiratory infections, diarrheal disease, and malaria, neonatal conditions, and cancers, and so on. So we can see that there are diseases related to water safety, very strongly related to the where the disease is treated. Safety and neonatal is also very important. As I have explained in neonatal death in the coronation, so the neonatal can be prevented by safe water treatment. And cancers, some of them are suffered from the waterborne. So the percentage is very low, but cancers are also important in some countries or some conditions. And the cardiovascular disease is also affected by environment, air pollution, tobacco, temperature control, and also the temperature deviation is strongly affected in cardiovascular disease, cardiovascular conditions. So the disease with the highest preventable disease burden from the environmental risk, it can be seen here. And insurance also can be protected by the health, can be protected because unintentional injuries can be protected by the prevented by the fostering the buildings and so on. So the science-based risk analysis is also introduced in Japan. So today we have some of you come from the governmental network. So I'd like to very briefly explain about the risk analysis system in Japan. So when we introduce the risk management, we have to do a risk assessment, science-based risk assessment. So we have an independent committee, which is a food safety committee in cabinet office to assess risk based on the scientifically and independently. So the hazard identification, hazard characterization, exposure assessment was done, and risk characterization was done in the food safety, or mainly related to food safety. So official report was sent to the government, and the interaction of risk management was done. For example, safety. So if we establish a standard, so we have to request for the evaluation to the food safety committee, and then they will answer to the item. So this kind of risk management can be effective to protect the health. So finally, the environmental risk and health issue will be related to the SDGs. So this is a conceptual figure that the health issue, the SDG 3, is surrounded by the other SDG goals, like water access for all, and ensuring study hours, and lower load for women, and safe water toilet. It is very popular in our field, but not only SDG 6, but also FUG, good living, adaptation for climate change, and safe water environment, both and affected health issues. So we need a cooperation to have a good public health status in our environment. So the climate change effect on human health, like through these factors, through these factors. So the severe conflict, storms of flooding, disease transmission, heat, air pollution, and food supply will affect the displacement and infectious disease and respiratory disease and malnutrition. So that will cause the illness, injury, and death. So we have to consider the root of the root and causes to protect the health. So in the our era is a very difficult era that the human and ecological risk is has a larger relationship because the population is increasing and in many of the countries, but in Japan the situation is a little bit different. But when we think over the total, the vulnerability and natural hazard and exposure will be it's going to be very big, and poverty and environmental degradation will affect the human and ecological risk. So we have to consider these factors whenever you, or wherever you are. And this is a figure that the GNP and that's attributable to environment per certain number of people. So you can see the OECD countries has a higher GNP, and the death attributable to the environment is higher in the BRICS countries and other countries which has many populations. So you can see that almost the very apparent relationship between the income and the health. So we have to consider the equity of the environmental health and also the people living in this situation. So this is the status of indicators at SDGs 3.9.2, which is also the water issue and unsafe water sanitation. So you can see that the higher burden is found in the fragile countries like Chad, Somalia, and so on in Africa and Sub-Saharan Africa and Southern Africa and so on. So the situation is very not so good in the fragile country, so that peaceful environment is very important. So our health is our issue that not only human but the environment issue is very related to protect our health. So we call it One Health. Maybe some of you may have heard of that. That not only human but the animal-human related infectious disease and other issues are very affecting the health. So the One Health is our concept that we have to protect the not only human health and the environment health is important. So with the figure that I have explained and early response and risk assessment, and if we can do a forecast, the precautionary approach must be introduced to protect our health. So I'm very sorry for the Ukraine issues, that no greater destruction of the environment than war is very serious in the countries. So the water supply and the peaceful environment must be protected to have a good public health. So in a conclusion, a century has passed since disinfection, so the safety of water supply has played a major role, and pandemics and conflicts changed now and changing the environment of the world. So we should be united to promote public health. So at last, I would like to introduce the congratulations to the Professor Yamamoto, our professor, that the Lee Kuan Yew Water Prize he got, and in this April. So I would like to make a congratulation to his work and the public health. And in the news that I found that he prevented the MBR technique to promote to do water treatment, but the water treatment technology prevented and public health and increased water security for hundreds of million people all over the world is helped by this technique. So what we can do, so is a last message that we should consider to protect the let's play together and let's consider for the what we can do for the environmental health and public health. So thank you for for joining this lecture and stay safe and stay healthy. Thank you very much.
So, Dr. Asami, thank you very much for a special lecture focusing on the water safety and also environmental risk management. I realize you categorize the 6 sections, including climate change and also a recent issue. So maybe our audience really enjoy to the different aspect related to the environmental risk, mainly focusing water safety. So now is the time for discussions or question answer. So any students or audience give the question to her. Just you can open your video and say something. No questions? Really clear? So every time, so I advise to the students to give the questions. It's a really nice experience or some attitude. So it means you try to find not so clear or it is important to confirm what you understand. So let me start my question to directly. So you talk about the last part is the little bit short to the One Health. So it means the many antibiotics is used, right? So it means it is new issue to deal with the water environment pollutions. Some of our research group students from Vietnam focusing on this antibiotics behavior. So how about your some additional idea related to the water supply or environmental risk focusing on One Health? Because you just really short talk about these topics. I'm a little bit interested in this issue.
Thank you so much for the question. And, it's very difficult question. Antibacterial issues is very popular and now getting popular in WHO too. And some of the estimates pointed out that the antibacterial microbial issues will be grown and almost the half of the problem will be related to this issue. So my personal impression of the antibacterial diseases are not only water, but also the food control and also the use of itself. But while we consider the water environment, the disinfection of the sewage water is the what we can do best in the sewage control. So if we can coordinate enough the whole wastewater, so it will be better to protect the environment with chlorination or ozonation or something which is not affecting the antibacterial function of the bacteria itself. But I am afraid that in Japan, even in Japan, we still have many wastewater will be flooded when the rain, the rain,
overflow.
Yes, overflow. So, so yeah, a kind of the problem that should
Yes.
mention. But also the food protection is very important because many of the meat and the chicken and so on was once treated by the antibacterial
Agent. Yeah.
uh, chemicals. Or,
Chemicals. So my impression is it is new some contaminants, but still it is really important chemicals to produce a lot of seafood or some others, and also the cattle is controlled in the very crowded space. So antibiotics is really big benefit society. But at the same time, so the once this is discharged or emitted to the environment, it is a new risk for us, as well as and in addition, it is not so easy to control. So in that sense, so we have to precautional or proactive. Some proposal or some discussion should be done to control the antibiotics agent or chemicals. So that's the reason why One Health concept is coming. But still, I have not heard any some strong policy from the governments. So they discuss, but there is no any concrete or clear countermeasures. So a little bit anxious about it. Maybe National Institute of Public Health should deal with this kind of issue. This is my personal comment or idea. So it is not so easy to deal with only the Ministry of Welfare.
We have to have a communication with their Ministry of Agriculture.
Agriculture,
Ministry.
yeah.
So
But
I had a presentation in the Japan Water Environment in the academic society that presentation from the agricultural side, the food production side. So it's the kind of communication with the food production side is also very important to consider health.
So thank you much. So are there any audience or students who have any questions? Good. Yeah, Pinky-san, please.
I thank you for the lecture, Asami Sensei. I was just wondering about slide 46.
46.
Yes.
Mm.
Regarding the nations and the GNP and yeah. I'm just assuming that these BRICS are developing to developed countries. But there is such I'm just wondering why there is such a big discrepancy between OECD and BRICS in terms of the GNP and debts attributable to the environment when they are mostly developed countries or developing countries. I think you can enlighten me on this. Thank you.
Yeah, actually, the situation is very much changing. So the GNP is now increasing in BRICS and also the China and India. So the big balloon here is China and India and the Brazil and so on. That the balloon is going to be increasing. But this are attributable to the environment, mainly caused by the air pollution and traffic accident is not so decreasing in these countries. So we have to consider how to decrease the such kind of environmental risks so that to protect the human health. So maybe we have to not only the history but how to promote the environmental issues that we have to consider not only the economic growth, but also the effective measures to protect human health. What is the priority of the public health must be studied in these countries. So I think some of them are introducing a kind of assessment, but I'm not sure that the standards are safe enough to protect the environment. So if you are responsible for these issues, so please look after the environmental issues and take countermeasures in your government.
Okay, thank you, Sensei.
Thank you. Any other questions? Still, we have some time for no.
We can paper can be. I think that it can be seen complete by internet. So, so please check this, and you can simulate how the bubble moving in the history. So you can see.
Might be this graph shown to the bricks is the biggest one. Bubble is China, and the second is India, and the lower part is the Russia, and the one more is the South Africa is a small one.
I think so.
I'm not sure it's Brazil and Russia, but the little bit which is Russia and Brazil, but I'm not sure. Anyway, so my guess is the getting these bubble positions moving or approaching to the OECD line, but sometimes a really big city, big country, it is not so easy to prevail to the good water safety or some environmental risk management in the urban areas, okay, but some other might be, that's the main little bit reason highlight of the problem, I guess. So time is almost come. So do you have, if there is no additional questions, so I want to close to this special lecture. And in addition, if you want to ask her directly related to these topics, maybe you can also contact directly with her, or if you want to contact with her, you can contact with me. I can introduce her email address. So it is a really nice chance for you because she belongs to the National Institute of Public Health. So this institute covered many aspects. So you can learn a lot of things from her, through her. So you can try to, if you have any questions, don't hesitate to contact to her and to me. Okay. So thank you very much for Dr. Asami. So I want to close to this special lecture. Thank you very much.
Thank you very much for joining.